Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargan Sachar, your host, and a proud member of Project Unity, a student-led initiative revolutionizing how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, especially to young people living and leading within today's health systems. In this podcast, we bring youth into dialogue with changemakers in medicine, public health, and digital health, to explore real stories, pressing challenges, and bold ideas reshaping health equity. Today, we're honored to welcome a rising leader and public health advocate whose vision and impact are transforming sexual health education and community well-being in Appalachia. Leah Loveday, a junior at East Tennessee State University studying community health. Leah was recently named a 2025 Truman Scholar, won the Harold Love Outstanding Community Service Award, and has authored research that bridges academic insight with youth-centered outreach. Her initiative, PEER-iod Education, provides puberty education to Appalachian youth ages 8 to 12, reflecting her commitment to grassroots impact. Leah, it's an absolute privilege to have you here with us today. To start, can you tell us where you're joining from and share a little bit about your journey?
Yeah, so I'm joining from Johnson City, Tennessee, which is where I go to school. I'm at East Tennessee State University, and kind of my journey to community health. So if you had asked me what I wanted to be when I was about 16 years old, I would have told you a medical anthropologist. I grew up with a teacher and a nurse in my household, and just overall found a really big love for reading. So throughout reading about medical anthropology, I had a really big interest just overall on like how human health throughout history has been viewed. But it was only until the COVID-19 pandemic, like many other people who study public health our age, became acquainted with what public health was. So my father was an emergency room nurse. Where I live in Tennessee is quite rural, and the hospital that he worked in the ER in not only serves our large county, but also where I'm from is a large tourist region that was open throughout the pandemic. And so I was able to see through his lens our frontline workers and how hard the pandemic had hit them, but more importantly, how important preventative medicine was. And through seeing my father's mental health issues, as well as the overall PPE issues at a rural hospital, that's when I really realized that there needs to be more work on prevention than the intervention that I was seeing that my father be trained from. And so that led me to apply for a program at ETSU, which is a very large rural health influencer overall in the South. And I did an Appalachian Studies program here at ETSU and came to know public health at our innovative public health campus, in which we study gardening, global health initiatives, but more low resource efforts and hands-on that are very acquainted inside of rural health. And so that led me to major in community health here at ETSU and get involved with exploring misinformation, rural health overall.
Awesome. Thank you so much for sharing. So your work intertwines community health, youth education, and regional service. What first inspired you to pursue community health, and were there personal or regional moments that shaped your path?
I think what first made me passionate about community health was the lack of health education that I received during school. And so, for context, inside of Tennessee, our standards in terms of puberty education and just overall health education is quite limited. Sex education is one day inside of wellness class. And just overall, the lack of health education left a lot of gaps that I was seeing in youth and how that impacts navigating teen pregnancy, for example, STIs. But more importantly, where I'm from is a very religious region. So I grew up in the Southern Baptist denomination of Christianity. And through that, one of the big things is talking about purity and sexual purity inside of religion. And so through that was my primary only health education. And the more that I saw youth come out of that damaged in terms of the perspectives of their own sense of worth, but also lacking information about healthy relationships, anatomy, and then going on to pursue these sexual behaviors without a trusted adult in their life because they might be ridiculed for actually having the action. Faith leaders who were the other trusted adults, potentially if they had this in confidence, talking about it with their parents. And I think once I came to ETSU and learned more about community health and the different health education initiatives that other states have, I realized what's really special about Tennessee is just the overall arching fact of like we have a very strict religious demographic here, and that kind of limits in how we address health education. And so through not having proper sex education, whether at church, inside of my home, and as well as at school, I think I realized very quickly that public health was the place that I could make the most impact of my love for education, but also research. And that led me to create PEER-iod Education, in which we do puberty education as well as get my sex education certificate through Rise Healthy for Life, which is a local nonprofit here in Northeast Tennessee that delivers responsible, inclusive sex education to Appalachian youth. And a lot of what we do is just overall kind of peeling away the stigma with adults. So we also do askable initiatives just in different areas, because part of it here is the best people who are sex educators are guardians themselves, and we want to empower those people of maybe you do have a certain worldview in religious wise, but how do you have those conversations with your children rather than it being one of silence? And I think through that, the one moment was just overall having a lack of it, but through now being a sex educator, having these more open conversations with my peers, younger people in my life, but as well as now with my family. And it's been a really big wraparound moment in terms of the work that I do of destigmatizing things and just overall in our region. That happening inside of my own family has been something extremely gratifying inside of community health and is part of my why.
Absolutely. Well, that was so imperative, especially for the region that you're from. And you actually touched upon a question that I had as well. So perfect segue. So as someone, as you mentioned, as someone from Sevierville, serving under-resourced Appalachian communities, what motivated you to create the initiative like PEER-iod Education? And then what critical gaps did you observe? I know you touched upon this a little bit. How did these gaps inform the program's development?
So I think the critical gaps that we have here is, so my freshman year, I decided I wanted to try to do a research project on school-based health and how is sex education, but overall health education look like in Tennessee. And so through that, I got to look at the Tennessee State Health Standards and became to understand a lot of what we have is very underdeveloped and doesn't match with evidence-based recommendations for when puberty education and adolescent health education should be delivered. So I found that PEER-iod education was only directly mentioned in about 8th grade. And as we know, the average age of someone getting their period is younger and younger. My mother is a 3rd grade teacher, and we had discussions about how she saw in her own classroom individuals start to have their periods younger. And so the fact that, number one, the PEER-iod education itself is not being delivered, even though it is a standard, we see that there's a gap of even these underdeveloped standards are not even being implemented inside of schools. Because it's a question of who. So overall in Tennessee, gym teachers are the primary provider of health education. And I think we have to ask, how do we prepare teachers to prepare curriculum for this? And I think that's one of the passion areas that I'm interested in, because in other areas, like in the north or different parts, there are health educators or guidance counselors who are trained to do this. Whereas how can we even be mad at the gym teachers who are delivering this in low resource schools when we're not equipping them with the education? So that's something that I'm interested in kind of developing more in terms of sex ed training. We know that I also agree that like people inside of schools are the most powerful people to deliver that information because they have a trusted bond with their students. So that's something that I've been toying around with. Of a lot of what we do through PEER-iod education is after school, because potentially we wouldn't be allowed to during school time, because Rise Healthy for Life, where I'm affiliated, we do not teach non-abstinence-based education, and the fact that that is affiliated at all, because inside of Tennessee, we have direct policy against comprehensive sex education, and it must be abstinent. So even just an affiliation.
Thank you. That was great. Thank you so much. So now we'll go a little bit into your research and real-world impact. Your efforts are grounded both in scholarship and grassroots outreach. Could you share an example of how your academic research or your published article has translated into tangible change in your community?
Yeah, so while I do have a love for reproductive health, another big part of my health, a really big part of my journey is rural health. And really what we see post-pandemic in terms of rural communities is we already have a standard of mistrust in government, and that's now kind of expanded into public health. And so my freshman year, I worked with my research mentor to basically do an article on how healthcare professionals can address misinformation. And that was directly targeted towards primary care providers that are a lot of the times hearing about why patients won't take the vaccine, for example. And basically we categorize different pieces of misinformation vocab. So what is the difference between misinformation, disinformation, but also where is it coming from? So part of what we explored in the article was identity-based misinformation, which I think a lot of my community falls into, of if I'm going to be a blank, I have to believe blank, is basically what we explored through this. Of if I'm going to be a Republican, I need to have this opinion in terms of anti-vaccination. Well, we know that's not true, that there's room for nuance in these communities. So part of how I've turned that into action is last summer I interned with the Virginia Department of Health, and I was working on a mobile health survey. Through that, I traveled all throughout our very rural 5-county district, and through that got to have a lot of just overall conversations of, yes, I was there to do a survey, but also I was wearing a Department of Health polo. So when you show up into churches or country stores, their overall reaction is one of just overall confusion, but also mistrust. And so a lot of what I did was just more visibility after the pandemic. And I think sometimes we undermine how important tabling and just overall visibility in community health is, and that part of combating misinformation is showing up to these communities, even though there is a bit of mistrust. But overall, while sometimes I do question in terms of like my public health path, where this whole misinformation segment of research comes into, it also applies to reproductive health, especially about what exactly sex education means. So a lot of the adults I talk to who are apprehensive are thinking that we're teaching what exactly like the mechanisms of sex is to a second or third grader. When in reality, it looks like meeting a second grader where they are and teaching them about healthy relationships and just overall like social cues. And that's something that we emphasize in Rise of like comprehensive sex education is building blocks. And I think too much we segment out what exactly sex education is because we center it on the act of sex itself rather than things like healthy relationships, puberty education, knowing your own anatomy and how that plays into health literacy. So overall, very glad that I spent my first year of college exploring misinformation research, because it really just taught me how so much of public health is redefining terms and misconceptions that people have.
Yes, 100%. And that's awesome. I really like the fact that you were able to kind of clarify what your idea of explaining to younger students would be and meeting them where they would be at. I'm sure that individuals and adults really appreciated that explanation as well. And like you said, visibility is definitely something that we should be focusing on when we describe these issues, whether it's, in communities that have mistrust and build mistrust or are just like reluctant to be learning about this information as well. So awesome. Your recent awards and honors, the 2025 Truman Scholarship and the Harold Love Award, celebrate both your leadership and service. So what did receiving these awards mean to you personally, and how have they shaped your vision for future work in public health?
So I'll start with the Truman. So last summer was when I interned with the health district in Virginia. And for a long time, I questioned if what public health is public service, whether that was due to being set back by misconceptions from people in my community, but overall just the feeling that public health is not a true part of political or also medical like direct service, because of what we do is kind of a weird mix of everything. But last summer while I was at the health district, being very hands-on in terms of my community, I realized very quickly that what I'm doing is public service, and that was a misconception I had to unlearn myself, and able to be confident enough to apply for the Truman. So what I loved about the Truman process and what it means to me is coming out of this, I have a very clear vision in terms of not only the issues that I'm passionate about, but looking into policy. So before this, I was very just set on doing sex education directly with youth, or working on research with it, because a lot of like Appalachian youth and communities in terms of how this looks and the misconceptions in terms of how literalist or Southern Baptist like demographic is not well charted in terms of research, and something I'm interested in exploring. But the Truman made me kind of look at the gaps in terms of sex education policy, not only in Tennessee, but the South overall, and beginning to really like understand my issue, that it all leads back to policy in terms of why am I not allowed to go teach puberty and sex education in the schools? And for a long time, I vowed that I wouldn't go into policy after a negative like freshman organization experience of doing like a mock government. Now I understand that like policy is so powerful, and it's the next step of like what we're always reaching for in public health. It really is coming down to working with policymakers or proposing evidence-based policy. So the Truman overall has given me just kind of like this fire of I now understand what I next need to change in my field for me to do what I really love, and that being teaching. So the Truman's also just unlocked overall amazing individuals. I think it can be kind of hard sometimes to isolate yourself. I call myself like I'm an optimist. Like, I have hope that something inside of like public health or what I do, because reproductive health can be a really hard field. So just unlocking a peer community that if you have an idea, they're going to help you. Like right now, I'm working on a conference proposal on reproductive health organizing with a fellow Truman, and it's really unlocked for what it means to be a public servant in the future of what does that look like in DC or going abroad to explore rural health. But I'm going to talk about the Herald of Love for a second, because so I had received the Truman and then afterward received the Herald of Love, and that's a memoriam of an amazing senator from Nashville, Tennessee, who truly worked to uphold public service and direct service inside of Tennessee. And so to receive that award from the state, I think meant a lot, because throughout the Truman experience, I was researching shortcomings in terms of Tennessee adolescent health standards, the way that we're delivering things inside of schools, but just overall, something that came up throughout the Truman process was, how do I make myself more palatable? I don't fully agree with that, in terms of suppressing the things that I believe and see for the world. And the fact that I got to receive an award from the very state that I love, but also have a complicated relationship with in terms of how they view public health and sexual health. I got to go back. It was the very room that I vowed that I would not explore policy again in at that freshman year experience. And I received an award in that room. Like, just overall, it was a wraparound moment of like, I see my future now, but I also like, my parents were also there, which was really important in terms of the man that inspired public health in me, being able to watch me receive a public health award. And so all of those things just mean I have a greater sense of who I am, but also a greater sense of my issue. And so I think anybody who's applying to those, no matter the outcome, you almost get a pulse check of your why, but you also get a pulse check of what is going on in your field right now, because so many things are rapidly changing in public health.
That's great. Thank you so much for sharing that. And I think it's so awesome that you were able to go back in that very room and experience a new narrative. So that's awesome. And we're so glad. I mean, we can see that you're doing amazing things currently in, working towards policy. And we hope to see you continue with that as well, even though you initially didn't want to dip your foot into that area. But we'll move on into education, mentorship, and equity. As a student leader like yourself, how do you support or mentor peers interested in public health research or community programming?
So I think part of why I'm so inspired by Project Unity was because I think the biggest gap is just overall people have this passion, but understanding like the evidence-based ways that like things need to be implemented, or that there are processes to help people. And so overall, we have this amazing program at ETSU, which is a regional institution, in which I get to help other people who are taking their idea to action, and that provides funding to them. But overall, for more people who are interested in community health, I think primarily it's by giving them opportunities. So here at ETSU, I helped start the Appalachian Regional Health Alliance, because I believe that what I'm doing is not sustainable if I don't have a team behind me and underclassmen to inspire. So helping people get sex ed training, for example, or teaching them about different products, and really it's just laying out the frameworks for people and allowing them. A key part of leadership is delegating. And so overall, just mentoring people through providing public health opportunities, whether it's giving out products, doing education on campus, but making sure that we realize as student leaders, we need to make sustainable opportunities as well as community partnerships. Because as we see for community orgs, it is so hard sometimes in terms of you have a really involved group of students who are helping your organization and then leave. But creating a pipeline in our community where campus and community reproductive health are connected, and just overall having connections about, I'm really interested in this summer, did an internship focused more on reproductive justice. And I think that framework is so important, intersecting with public health, and having more theoretical based conversations with mentees on like, there is a why of what we do to this. Because I mean, it gets kind of dangerous in terms of, we are providing sexual health information and education. And that is a sensitive topic that we need to make sure that we have all the correct information. So for people who are not involved in community health, going ahead and clarifying some of those steps of like, how do you build a health education presentation type deal. So
definitely. Well, you touched a little bit upon how educational institutions like your regional university, ETSU, play in empowering students to lead public health initiatives in your community. But how can higher education, in your perspective, or can it, in your perspective, better prepare students to design culturally relevant interventions that reflect the needs of maybe specifically Appalachia and similar regions?
So I think one thing that ETSU is doing amazingly, and I touched on it just a second ago in my question, but literally creating yearly and systemic funding, but as well as mentorship to engage with our community partners. So here at ETSU, we have had a long-term focus on community engagement. And part of ETSU Elevates is having a community advisor and a faculty advisor, and those three people working together. And I think that's just an amazing way that ETSU and just overall regional institutions can work together, of pairing together not only students with community partners, but also academics, so that we have a student who has a passion, we have a community partner who is experienced and has expertise in their own area, but also a faculty advisor that's going to create long-lasting mentorship. Overall, that's something else that ETSU does that I think is more unique in terms of public health education. So at other institutions, you might be learning statistics, for example, more epidemiology, whereas what I love about ETSU and why I came here is that we focus on very hands-on activities that go behind the why of public health. So for example, we garden, we build shelters, we make low resource shoes, and that's a pinnacle project. It's called Project Earth. And that's out at a different campus. And basically all of these activities that we do is to teach community health students that in public health, we are a low resource field. And that might look different at a high class nonprofit, but right now, as we're seeing in funding, it's going to be low resource. You're going to have to work in that mentality of deficit and being creative. And that's something that I think ETSU does very well in terms of our students learn very quickly their sophomore year how to work in this low resource mentality and see creative solutions. And then immediately we're going into project implementation and research. And that's something that I will carry forever into the different spaces I go into of, I know I can creatively work with this amount of funding or this community because has worked to create this curriculum that acknowledges the reality. So that's another thing regional institutions can do in terms of just looking around and realizing that, well, yes, there are different skills that matter, but also mentalities matter. And that's something that I think hands-on service or community engagement in terms of public health classes is so important.
That's awesome. It's awesome that you were able to experience that at your university and are now looking to carry that ideal as well. So as you've grown academically and through service, how has your sense of what impact means evolved?
I think for me, what impact mean has evolved in terms of when I first came to college, I was quite convinced that I need to have some grand scale impact. So for example, like creating more of a systemic deal of sex education trainings. But I think overall, something that I've learned very quickly is what does realistic impact look like? And how do you meet your community where it is at this moment and not try to push it more forward than what a timeline is? I had a very hard sense of the way that things like change works is very fast, I think, in terms of high school, college. But when you really understand good and sustainable change takes time. And so, for example, with PEER-iod educators, we've had like a couple of workshops, but overall realizing that I need to slow down and that the quality of workshop of having a 5-week series with an amazing group of kids is more impactful than trying to go to 40 different organizations to do it 1 week. And I think that's just something that all young public health leaders need to recognize, if there's a reason that your community works on a different timeline in your campus, because we see that the most efficient public health programs are the ones that are held annually and have, like inside of the classroom, more of a long-term relationship with them to build a connection. So I would say overall my sense of impact has become more quality over quantity in terms of what that looks like, but also relational. I remember one of my favorite ever workshops was PEER-iod education is designed to be co-ed. And our first one was not co-ed. It was at an institution called Girls Inc. We had it at an after-school program and got to finally implement it in terms of its co-ed format.
Mm-hmm.
And I think just overall watching the students connect with one another and learning each other's anatomies and labeling together, speaking openly about these topics, I left very moved in terms of the way that we unravel some of these stigmas and overall how it impacts how stigmas might influence policy in the future is by starting at this age of having these conversations. And just overall, I think leaving ETSU, that will be one thing that sticks with me in terms of like why I love health education at the end of the day, is that it's part of one person's greater story, and you're never going to be able to see exactly, no evaluation can put together how that impacts their life.
That's great. Thank you for sharing. And before we close, I'd love to ask you a few reflection-centered ideas. What is one belief or practice that you've reevaluated over your journey? I know we just talked a little bit about what impact means and how you've kind of seen that change, but is there a belief or practice that you've reevaluated or thought differently about after an experience in your journey?
So one thing that I've been unraveling in terms of recently is the way that communities play a role in research. So prior to this year, thinking about the worlds of public health in terms of needs assessments, evaluations, but what does it look like to really have the populations that you work with influence your program from the get-go in terms of having the youth themselves lead the research? So I'm really interested now in unraveling this world of prior research methods, but community-based research methods of like the way that we empower youth is, yes, we can do surveys on them, but what does it mean to equip them educationally by guiding them through the research process and like dreaming one day of doing an Appalachian youth public health like academy in terms of how do we unravel these issues that we're seeing in our communities from youth perspectives and having them lead the research and the solutions to them. So that's one thing I'm unraveling going into looking at my future in academia and just overall community service.
Thank you. And then you touched upon this a little bit, but our previous guest wanted to ask you what makes you excited about youth in healthcare? And then have you had any specific interactions? I know you shared the one about your first workshop at the after school, the co-ed workshop, but have you had any interactions with youth that have changed your overall perspective on problem solving or approaching this journey?
So I think one thing for me is another part of my life is I work as a patient registration volunteer for Remote Area Medical, which does traveling, pop-up free medical vision and dental clinics. And what excites me is we have these college chapters come in to these areas. And one thing that we lacked inside of RAM was interpreters because we're serving so many more diverse populations, but it is an Appalachian-based nonprofit that didn't acknowledge these language issues. And I think one thing for me is every time I go to a clinic, I get to watch college students basically assemble themselves and run their own interpretation volunteer movement of meeting a gap that has still not been addressed by a greater nonprofit, but just getting to see the way that they interact with diverse populations as well as filling a gap inside of our clinics is one thing. And then an impactful moment, I think also for me in terms of working with youth is at Rise Healthy for Life, we do have a Teens Rise program in which they receive sex education but have conversations on how they can carry comprehensive sex education to their peers and just getting to hear more about how they live these every day in terms of their conversations. Because again, I do believe that peers are the most powerful educators, some people that are just like us. And so I think just overall hearing their stories about how they question their classmates when they make certain comments or assumptions and turn that into a teachable moment, that excites me that we have youth who are so passionate, but also experts in terms of the topic and their lived experiences that they're able to reach people to prevent different things that we're not currently addressing systemically in terms of school sex education or after school.
Definitely. And it's great to see the youth getting involved too in those conversations and teaching their peers as well. So that's great that you were able to notice that. What's one question that you have for our next guest? We interview so many different people involved in policy, youth healthcare leaders like yourself, and medical professionals and healthcare professionals as well.
So one question I have, because recently I'm getting in a big reading mood, would be, what is one public health book that has changed your life in the way that you see your field?
Sure, that's an awesome question. And finally, what message would you like to share with the next generation of public health and healthcare leaders?
I think the biggest message, and this is the one I tell all freshmen who enter on campus, take time and find one person. One person will say yes, yes, one person will give you an opportunity to take a chance on you. And it is a privilege for someone to take a chance on you, but do not be discouraged if it takes time to find that one person, because you can form truly just a long-term relationship with them that will change forever in terms of mentorship and mentee. Try and find your one person. That's just the first step.
Awesome. Thank you so much. And Leah, thank you so much for sharing your journey and insights today. We had an amazing conversation. Your dedication to youth equity and Appalachian communities is truly inspiring. So for listeners who want to learn more about Leah's work, whether it's the PEER-iod Education Initiative, her public health research, or her journey as a Truman Scholar, where can they connect with you? Perhaps a publication link or platform of your choice?
So I do have LinkedIn for Leah Loveday, as well as my article is linked in there. The article is an editorial in the American Journal of Public Health, and it's called A More Nuanced Understanding of Misinformation and Redressal for Healthcare Professionals.
Thank you. And we're so grateful to have had this conversation, Leah, and to amplify the story of someone reshaping how community health evolves in Appalachia and beyond. If you're ready to take the next step, visit projectunitynfp.org to connect with changemakers, explore student-led initiatives, or get involved with future episodes. I'm Hargun Sachar, and on behalf of Project Unity, thank you for listening. See you next time on Call.